Yeah, maybe Michael, we can talk a little bit about some of the challenges that you've seen over the years with med
Yeah,
tech companies and with this challenge regarding inventory.
yeah.
And we can kind of maybe brainstorm off of that.
I mean, that's what's also, I think, for us or for me, the reason to reach out to Terso, right? Because one of the major challenges in the medtech industry is the lack of end-to-end transparency or visibility of inventory. So items, they pass often multiple hands, right? Manufacturers, distributors, hospital, right? And the handoff of this process can be messed without a connected system, right? And we try to find out what is the best way in order to integrate solutions like Terso's RFID cabinets to our, let's say, customer solution SAP, right? Because so far this was not possible to integrate these IoT sensors and RFID cabinets seamlessly to SAP systems. The problem here is as well, right? Our, let's say, industries are highly regulated by the FDA and other regulatory authorities, and all these processes must be compliant, right? And this is one of the reasons, right, why we reached out and why we now have developed, I'd say, a great partnership and our solution LiveSync that would help customers in order to get more visibility on their inventory levels, on their products, where are they, right? And help them to reduce inventory costs, right? And in order to provide, let's say, more efficiency on the inventory management in the field.
Yeah, exactly. And what I was big learning for me over the past 20 years has been, I was new to healthcare when I got into this, and inventory management, let's say in retail, is a lot different, right? It's being out of stock is okay, right? Because you go to the next store if it's a retail situation, but in healthcare, obviously for medical procedures, oftentimes that are critical, the hospital, the surgeon, the nurse, the clinician being out of stock of something, a implant, a specialty pharmaceutical, that cannot happen. So to prevent that, there's just been a plethora of inventory that's been created, that's been moved, that's been put into the supply chain to prevent that. And it's been up to this point very manual to track all of that inventory throughout the supply chain process. And I think it was just sort of a cost of doing business for a long time and has been. We need inventory. The hospitals would explain, oftentimes that would be on consignment. The med tech company or distributor would allow that. But I think as we look in healthcare globally, to improve efficiency, to reduce cost, we need inventory. The reduction in inventory and improve efficiencies around inventory management has really risen up. We're seeing, I think, Michael, you'd agree, in the
Yeah,
kind of the critical, items that companies need to address. So
yeah,
our partnership has really been formed at the right time
yeah,
to address a really compelling need in the
yeah,
industry.
yeah. And it's so true, Joe, right? And just last week we had our advisory board meeting here in Freiburg, and we have one advisor comes out of the University Clinic Rostock in Germany, and he was telling us a story about issues in the inventory management on their sites, right? They had to perform a very urgent heart surgery, and they are also served by their vendors with consignment and field inventory. And they were knowing, hey, we have this heart implant, costs about 25,000 euros, right? They couldn't find it, right? The
Yep.
problem was really, the patient was really nearly to die, and they had to really urgently bring in a new heart implant to the hospital in order to perform this surgery. Now, these things really could go away, right? Because our solution now, the Terso cabinets and LiveSync, this would give the complete visibility to hospital personnel. They have a mobile app. They can type in, right, what they're looking for, and the mobile app will guide them exactly saying, hey, this implant is in this building, in this floor, in this cabinet, right? This is the
Yep.
expiry date, and that's the temperature of the cabinet. So all of this information is floating nicely, right, between the Terso cabinets, between SAP, from the vendor to the hospital everywhere, right? Full transparency. And if the implant is consumed out of the out of the RFID cabinet, our customers get immediately the consumption signal, right? They can invoice it right away and send a refill.
Yeah, exactly. Yeah. And completely, it's an integrated system, right? And that hasn't been there before. I think the other compelling thing that's happened, particularly since the pandemic, has been labor, shortages of labor. If you're doing this manually, the only way to gain visibility is to have people going in and counting or tracking or researching, doing expiration date audits that you mentioned earlier, Michael. And now that labor just doesn't exist. That shortage of people at the hospital, at the ambulatory surgery centers, for the med tech companies. So that it makes the challenge even greater. So automation through RFID, through software integrated together is really a key thing. And I don't want to underscore also the comment you made, Michael, about compliance, product integrity, expiration date management. Has this specialty pharmaceutical been refrigerated through its life cycle at the hospital? Is it compromised in any way? Having that ability to know that, right, and have data to prove that helps with FDA, helps with Joint Commission, those types of regulations as well. So there's a quality aspect to what we can bring in through our partnership as well.